everyone, my name is Phương Hảo. Today I will do the read and tell. In part 1, I will read fighting curses. Since 1750, doctors have discovered cures for many diseases. They have also learned how to prevent some viruses and bacteria from making people ill. Vaccines in the past. Vaccines are medicines that teach a person's body how to stop a disease in the future. Smallpox is a disease that killed millions of people. In the past, doctors in Asia and Africa put smallpox scraps up a healthy person's nose to give them a weak smallpox disease. This worked as a vaccine on some people, but it killed others. In 1796, a British doctor called Edward Jenner made smallpox vaccines from cowpox, a disease that cows had. His vaccine stopped thousands of people dying from smallpox. Vaccine today. Today, doctors and nurses inject vaccines. They use a needle to put the vaccine into a person's arm or another part of their body. The vaccine is a weak type of a virus or bacteria. When a vaccine is inside the body starts to make antibodies to attack the vaccine. Antibodies are substances in the blood that can kill viruses and bacteria. When the body has learned how to make the antibodies, it's ready to kill viruses or bacteria when they get inside the body. This prevents the person getting that disease in the future. Bacteria and disease. In 1864, a French scientist called Louis Pasteur discovered that bacteria in the air could cause disease. Then he had the idea that you could prevent disease by stopping bacteria getting into the body. A British surgeon called Joseph Lister used Louis Pasteur's ideas to make the first antiseptics. Antiseptics were substances that could kill bacteria on tools used in surgery. They could also kill bacteria that make wounds become infected. This stopped many people dying after they had surgery. Penicillin. Penicillin was the world's first antibiotic. Antibiotics are drugs that can cure illnesses caused by bacteria. Before penicillin, people could die from a small wound in their skin if bacteria made the wound become infected. Alexander Fleming discovered penicillin in 1928, but two other scientists, Howard Florey and Ernst Chen, tested penicillin to find out if it was safe to use. They also made penicillin that they could inject. Penicillin helped thousands of wounded soldiers during World War II between 1939 and 1945. Since that time, penicillin has saved the lives of millions of people. That's the end of Unit 5. In Part 2, I will read Unit 8, Medicine in the Future. Medicine is very different today from how it was in the past. What will medicine be like in the future? Living longer. Medicine has helped people to live longer. In 1900, most people only lived to be about 45 years old. But today, people in many parts of the world live 30 years longer than they did in 1900. Some people say that by 2060, many people will live to be 100 years old. New medicines. In the future, scientists will discover new medicines. For example, some drug companies are trying to grow plants with vaccines that people can eat. It's expensive to use vaccine that doctors and nurses have to inject. Vaccines that people can eat will be cheaper and much easier to use. For example, bananas that contain vaccines could prevent many children dying of diseases that can be cured. Medicines for everyone. In some places in the world, even today, many people die from diseases that can be cured. This is usually because they don't have enough money to buy the medicines that they need. For example, about 1 million people die from malaria every year. In 1909, one of the world's biggest drug companies started to sell cheap medicines to some countries. In the future, hopefully, everyone will get the medicines that they need. This could happen if more drug companies sell cheap medicines to poor people. New ideas. Some hospitals use robot doctors with computer screen and cameras so that doctors and patients can talk to other doctors at other hospitals. Surgeons also use robots to help them to do operations. In the future, doctors will also use tiny robots called nanobots. Doctors will inject nanobots into a patient's blood so that the nanobots can move around inside the patient's body and discover what is wrong. In the future, maybe robot surgeons will do operations. Now, scientists are also developing medicines to help people to grow new fingers and other body parts when they are wounded. There will be more surprises and new discoveries in medicine in the future. Staying healthy. The best way to stay well is to stay healthy. Try to have a healthy diet and drink 8 glasses of water every day, and more when it's hot. Keep clean, take a shower often, brush your teeth every day, and wash your hands after going to the toilet and before you eat. Most of us know that exercise helps us to stay healthy, but did you know that people do more exercise if they do a sport that they like or that they can do with friends? What do you do to stay healthy? That's the end of part 8, and also that's the end of my presentation. Thank you for listening. Goodbye.